Well, this is part two here. I guess my fingers accidentally stopped the video. All right, so step through with your walker for visual aid as best you can see. All right, imagine left side is my operated hip, total hip replacement. Step through and you walk through. Left side is total. Let me have a visual aid here. Okay. Walker, operated hip. When you step through, you want to make sure you have the walker advanced forward and you're trying to load your quad properly. It's retraining, okay? So whatever, if you think you're doing it right, you're probably doing it wrong. If it feels like you're doing it wrong, you're probably setting new neural pathways and you're probably doing it right. So use your eyes to help you with this, okay? So again, walker, operated hip. Keep the walk going, step through, okay? You see how I'm not trying to just skip over it, and I'm not extending what's necessary time. This is a normal step where you pay attention, walker, operated leg, step through. And you're gonna probably put maybe from what I was doing, just partial weight bearing, maybe about 40, 50 pounds of pressure, maybe 1/3 of your body weight roughly. So that way your quad has time to think, oh, okay, that's my job. Thanks for letting me know. So that retrains your quadriceps. Quadriceps is a knee extender. It also helps with a deceleration upon when you're stepping through, okay? So when you come here, it's quad extension, that's quad. And you're loading, okay, hamstring decelerate, but you're loading and you're eccentrically using your quads as you're pushing past the next phase of your gait cycle, okay? Loading, stepping through, quad, 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 all right? Okay, because the quad, you stretch it like that, right? That stretches the quad, okay? This contracts the quad. So as it's going back and you're stretching the quad, it's eccentrically loading, all right? Okay, so if your quad is weak, what's gonna happen? Your leg's gonna buckle. Okay, we don't want that. Okay, the last exercise with something, where did I go with my little prop? Here it is. Okay, so carefully, if you need help, if you're gonna insert this, you probably wanna do it with someone doing it for you. So you're not overextending yourself, but with the anti-hip precautions, you can forward flex how you may wish. So you wanna make sure that you have a chair or something, you can sit down in the chair. All right, let's make a chair here. Well, it'd be helpful if you can get a grabber, a reacher or something, so you can actually put it over your legs. So let's say someone came and helped me put this on. All right, we'll fast forward here. They're gonna help you pull it up, especially if you're on any type of medication. You don't wanna be head over and lose your balance. So safety always first and always. All right, so the last exercise number 5 is the partial squat with the band. So what you wanna do is, you wanna keep this high enough so as you're partial squatting and you're loading, all right, only load out, keep the bed behind you. So if you gotta sit down, you have something to sit upon. Don't go an air chair. Have actually something you actually sit upon if you tend to overcommit, okay? All right, with this exercise, if you want to, you can actually maybe put your, I won't do that. You want to use the walker properly for what it's intended to be. So you just go squat down as far as you can go to I would say probably about 12, 14 inches, depending on your height, proportionally might be a little more. There's no need to go past a quarter squat, okay? Don't hit parallel, because that's where your quad is strongest between, it starts to flex, probably to the point of about 70 degrees. So somewhere between 30 degrees of hip knee flexion to about 60 roughly is probably where your quad's the strongest, okay? So again, activate your hip abduction with the band here, and as you squat down, again, 5, 4, 3, 2, 1, 5, 4, 3, 2, 1. And try not to lean and cheat, just loading. Because if you're doing this properly, you should be able to, theoretically let go of the walker. Do not do that if you're only 2-3 weeks post-op. That's something more advanced, because now you're isolating, and not only are you doing this muscle group for external rotation, but you're loading your quads, okay? All right, so those are the 5 exercises. Quad set with E-stem, where you're sitting down on the ground, that leg straight, Second exercise number 2 is actually with a foam roll underneath or a rolled up beach towel with the E-stim unit. How long should you do this? I would say probably 5 minutes per exercise, 5 minutes on quad sets, maybe 5 minutes with the foam roller, the short quad sets. And then isometric clam shells, isometric, so you can probably do like, you know, a couple sets of 15, nice and easy, slow on, slow off. The forward walker step through, maybe through one of your favorite songs. Don't go crazy, you know, like put on a 4 or 5 minute song. You can step through and just kind of practice that symmetry, all right? And the last one, the partial squats with the band. So the partial squats with the band, I would probably wait till you're actually 30 days out, 4 weeks out from there. Focus mainly on probably the first 3 that we talked about. The last 2, you know, maybe towards end of week 4, start of week 5. Double check with your orthopedist to make sure that's all right, okay? So thanks again. Love you.